Hi everyone, welcome back to Rabbi's Reflection. I'm glad that you're joining with me today. We'll be continuing in our study of Kitchen Table Wisdom by Dr. Rachel Naomi Remen, and today reading the story Healing is Mutual. Stay with us as we read through the story and then offer some reflections. One of my patients once defined a healer as someone who can see the movement toward wholeness in you more clearly than you can at any given moment. I remember flying to a medical conference with one of my colleagues. Between San Francisco and Boston, I healed him twice, and he healed me 3 times. Frank is a middle-aged internist, the director of one of the medical clinics at a Midwestern inner-city hospital. For some time now, he has secretly thought about leaving medicine for something else, something more satisfying. Someone suggested that he try a physician's training program I teach before he made any big choices. And for the past 9 months, he has been reclaiming for himself that which is satisfying in his work. He tells the story about returning to his clinic after a weekend workshop on the power of intuition. His clinic is at a large teaching hospital. As faculty, part of his job is to see those patients who have no teaching value. Those who present a medical challenge or a diagnostic problem are saved for the younger doctors who are still in training. On this particular Monday afternoon, one of these patients, a Mrs. Gonzalez, was his regular 2 o'clock appointment. She was an elderly lady, maybe 80, in the last stages of breast cancer. No further cancer treatment was available for her, so at each visit, he would listen to how her week went, adjust her pain medications, and treat any other complaints she had as best he could. On this Monday, as always, he made adjustments in her palliative regime, and then, thinking of the weekend, he decided to take a few moments to reflect and see what his intuition had to say about her. Much to his surprise, his intuition suggested that what would be most helpful to Mrs. Gonzalez now would be for them to pray together. He was not a praying man, and he began to sweat. Professionally, this felt risky to him. He reviewed the danger checklist from the workshop in his mind. Was there some reason not to do this? Would following his intuitive insight cause anyone harm? Would it delay or negate some needed treatment? Would it embarrass or humiliate anyone? Going down the list, he could not find a good reason to discard his insight. So there it was. So Frank turned to this ill, grandmotherly patient and said, "Mrs. Gonzalez, perhaps it might be good if we prayed together." She looked at him and began to cry. Fortunately, he didn't do what I had been trained to do years ago when a patient cried. He didn't call a nurse. He did what he had learned to do in another of the training workshops. Taking her hand, he simply received her emotions respectfully and waited. Still holding his hand, she said, "That would be very wonderful, doctor." Then she told him that she was a Catholic and asked him if they could kneel down. Shaken, he looked toward the door. It was closed. He was on highly unfamiliar ground, but he was in it already, and he decided to continue. "Certainly," he replied. So, in his white coat, he helped her kneel down, and he knelt down with her in the tiny examining room. She began to pray, first in Spanish and then in English. He had not prayed for many years, but a calm settled over him, and his memory, awakened by the sound of her voice, gave him back a prayer from his childhood. When she had finished, he said it out loud. There was a long, comfortable silence. Then, very gently, the old woman reached across and touched his cheek. First in Spanish and then in English, she asked God to bless him and strengthen him in doing his important work. He says he can still feel the touch of her hand even 6 months later. He remembers it when things get tough, and it helps him. He often prays with his patients now, both for them and for himself. One of the reasons that many physicians feel drained by their work is that they do not know how to make an opening to receive anything from their patients. The way we were trained, receiving is considered unprofessional. The way most of us were raised, receiving is considered a weakness. What I think Dr. Remen is trying to teach us in this story are a couple of things. One, with the title Healing is Mutual, I think what she means is that often, or is that, healing can happen on both sides of the equation. Both the doctor and the patient can be healed in a conversation or an interaction. Usually, we see it as healing is one-sided. The doctor provides the healing for the patient. And what she is trying to point out in this story, and in the story of her colleague with a Mrs. Gonzalez, is that there is something that Mrs. Gonzalez can actually give to the doctor that is going to provide that individual healing. I think it's not a stretch to expand that to many of our own interactions, whether we are a doctor or not, whether we're in the healthcare profession or not, whether we're a patient or not. Whenever two people come together, there can be healing between each other. Someone can receive healing and someone can give healing, and the feelings can be mutual. Dr. Remen also points out in the beginning of her story by saying that what it means to be a healer is to see the movement in someone else towards wholeness. What does that exactly mean, to see the movement towards wholeness? What I think she is at first challenging us to recognize is that healing isn't something, wholeness, healing is something that is should be thought about in terms of wholeness, not in terms of improvements necessarily, or checking something off the box, but that there's something idea of wholeness, a sense of being more complete, more full, more whole, more at ease with oneself. I think too often we see healing as I am now cured of this, but there are a lot of things that we cannot cure ourselves of. There are a lot of things that we will need to continue to live with, and being able to see the wholeness or see the movement towards wholeness in someone else is going to help them in their healing. This specific story focuses on a story of a colleague of hers with a woman who was named Mrs. Gonzalez. She was a patient of his, and the reason why this doctor saw her is because she had no teaching value. Gosh, imagine if you were considered someone who had no teaching value. It wasn't worth it to see you, because again, back in the kind of more traditional medical jargon or way of looking at things, teaching value would imply that the person can be healed, that they can be cured, that they can, that someone can learn something from being able to take them from having something to not having something. But I think, again, as Dr. Remen always does, she just kind of breaks down those dichotomies or those boundaries and says, well, even with Miss Gonzalez, there is something of value here. And so this doctor sees her, and yes, she has a late-stage cancer that cannot be taken away. It's going to eventually probably cause her death. But that doesn't mean that she doesn't have something to teach you. That doesn't mean that there can't be some type of healing that's involved. It might look a little bit different. And so in this case, it might look like prayer. The doctor, then kind of relying a little bit more on his intuition, after he's gone through whatever medical needs he can provide, thinks to himself, maybe Miss Gonzalez would appreciate a prayer. And she does. He's present with her. He kneels down on the floor with her. He extends or offers an appropriate touch. And that prayer experience is so powerful for Miss Gonzalez and so powerful from the doctor that he says months later he can still remember the touch of her hand on his. I think so often in life our interactions with each other are, what can I provide for you? Especially if we see it in terms of a power differential, or if we see ourselves as the one who's providing the healing. But what Dr. Remen is trying to teach us or open us up towards is, how can I receive from someone else? Sure, you might be the doctor, or you might be the nurse, or you might be the person who's providing comfort for someone else. But what can they give to you? How can you receive from someone else? And if we begin to see or look at the relationship in that way, I think we can then understand how the idea of healing can be mutual, that we can receive something from it, and not just the other way around. So I hope this gives you a little bit more to think about, and I look forward to seeing you soon. Be well.